initiate with the test of glycated hemoglobin, measures the level of glucose deposited in red blood cells in the last 3 months. And it's a key role in monitoring of glycemic control for reporting the retrospective index of plasma glucose. It's used since 1958 to glycemic control. But after 1993, DCCT and UCAPDES show us about impacts of glycemic control on the chronic diabetes complications. And what we have until now? We know that glycated hemoglobin can serve as a parameter for risk evolution to diabetes complications, and little is known of statistical data in relation to the prognosis of other pathologies. And the objective of our study was to analyze the glycated hemoglobin as prognostic and predictive marker for hospitalization in patients with other disease. The study was performed in a hospital having a solicitation protocol of glycated hemoglobin for all patients with hyperglycemia in the moment of hospitalization. All patients who required hospitalization for several diseases in general clinical, patients between 30 and 60 years old, study carried out in the 5 years, glycated hemoglobin analysis by HPLC method, outpatients and hospitalized for clinical pathologies unrelated to patients with diabetes. Parameters were set to analyze glycated hemoglobin equal to or less than 6.9%, 7 to 90%, and higher than 90%. Statistical difference were considered significant at p less than 0.05. So, about the results, amount of patients analyzed, hospitalized was 2,400, and outpatients was a little bit more, 80,000. And this table, too, is a comparative table between the glycated hemoglobin outpatients and patients requiring admission at the hospital. So, in hospitalized patients, the glycated hemoglobin less than or equal to 6.9% was 57%, and in outpatients was 90%. And higher than 90, hospitalized patients was 17%, and outpatients were 1.7%. It's a big difference between this group, and it was I will show you next. There are some issues in hospitalized patients. We know about the deleterious effects of hyperglycemia, such as affect the immunity and healing, increase of oxidative stress, endothelial dysfunction, and increase of pro-inflammatory and prothrombotic factors. On the other side, a study published in New England Journal called Glycated Hemoglobin, Diabetes, and Cardiovascular Risk in Non-Diabetes Adults show us about other ways to see glycated hemoglobin. About the study, 11,000 Americans, patients in Johns Hopkins Public Health, no history of diabetes or heart disease, and the samples were collected between 1990 and 1992, and the volunteers were followed for 15 years. So, about the study, glycated hemoglobin predicted not only the risk of diabetes, but also the chance of stroke, cardiovascular disease, and mortality in general. I will remember you that not diagnosed diabetes prevalence in these patients. And I put the two tables here. It's different studies, but in Johns Hopkins, the most important glycated hemoglobin was between 5 and 5.5% with 45% patients, but more or equal 6.5% was 4% can demonstrated more risk of cardiovascular disease and mortality in general. And in our study, the glycated hemoglobin higher than 90% in hospitalized patients was 17%. Another study, joint effects of C-reactive protein and glycated hemoglobin in predicting future cardiovascular events of patients with advanced atherosclerosis, show us that glycated hemoglobin higher than 6.2% and C-reactive protein higher than 0.44 milligrams deciliters contribute to the cardiovascular risk of patients with advanced atherosclerosis. It's another way to see glycated hemoglobin in patients with not diagnosis of diabetes. And the level of glycated hemoglobin below 7 is considered as a major goal in diabetes management, and the reference for glycated hemoglobin in non-diabetes adults is less than 5.6%. So we can see this in the CCT and EU CAPDS. The study show us about the risk of microvascular complications, and glycated hemoglobin above 7, there is more risk to retinopathy, nephropathy, neuropathy, and microalbuminuria. In our study, the glycated hemoglobin showed significant importance in relation to patients requiring hospitalization or not, demonstrating that it can also be used as an independent prognosis tool of the patient's pathology. Of course, more studies need to be done for this constatation, but it's a start to see glycated hemoglobin as another way. And the conclusion is patients with high glycated hemoglobin have greater need for hospitalization regardless of pathology, having this method as an important prognosis marker. Thanks.